to make this vlog, and it is a health related vlog, so I'm going to try to make it short because I am about to pass out from exhaustion. However, y'all do know how I babble, and I will understand if you don't want to watch to the end. But those of you who have been keeping up with my health drama over the last year, as you guys know, I went to Tyler to try a new medicine, an infusion for some for my MS, the last medication I had. And it's very common when you try. The infusions are given because it keeps symptoms, or it helps keep symptoms at a minimum for longer periods of time. There's many different ways you can get infusions. You can get shots, pills, I guess, but you can give yourself shots weekly or daily. I don't even know the whole. I'm still so new to this. I don't know. But as y'all know, last month I went to Tyler to try new medication because the first one they tried just didn't do much. It didn't last long. And they hooked me up to a heart monitor because I'm a heart patient, and that's just what they do no matter where I go. And I went to Tyler because specialists around the Texarkana area do not take my insurance at all. And while I was there, I was having episodes of AFib, which is not common for me. I have VTAC, that's why I have my defibrillator pacer put in. Well, I had my follow-up appointment today with him, so I had to drive all the way to Tyler, and yesterday was crazy busy. And then all the way to Tyler, we had storms to drive through. It wasn't fun. And I got home a little bit ago. Excuse me if I yawn. I apologize. I can't edit, or nor do I really want to. But some very good things happened. I'm going to go into a little bit of detail about my health stuff, but they're also in other vlogs. So I apologize if this is a repeat. But I have several medical conditions. My cardiologists, or the diagnosis that I have gotten from cardiologists over the years, starting in '94, is hypertrophic cardiomyopathy, which is a thickening of the wall of the heart. Hypertrophic meaning the upper wall, which, you know, it's 4 chambers. It's one of those by the flappy thing. I don't know these words, okay? I'm sorry. I'm very medically stupid for having so much wrong with me. But anyway, one of those areas are thickened. And I had a single bypass, not for heart disease or clogged arteries, but because I had a birth defect that was found in 2013, and the subsequent open heart, and I mean a big open heart, because they can go through like your shoulder muscle now or something, I've heard. But anyway, was done in 2013. That's 5 years ago. And I still have way too frequent episodes of chest pain. This new doctor started me on a medication, a calcium blocker. I'm already on a beta blocker. And also started me on a medication for angina, however you want to say it. And I had my follow-up today from seeing him in hospital. And he once again told me that when he picked up my chart, he was thinking this one person could not have all of these health issues, because I have a multitude of major health issues. Some minor, like my thyroid and things like that. I still have a thyroid, so it's not like it's replacement therapy. So that would be considered minor, and other things. But he said there's no way. Well, after I was in the hospital 4 days, keep in mind. So he had a lot of time for him and his staff to come. I signed release papers and to gather information from different physicians. And from an echo that they did, and they also did a heart cath, which was normal, thank God, because the nuclear stress test was abnormal. That's why they did the heart cath. But one of the echoes that they did previous in 2 different places. One in Longview, and this is where I had my open heart, in Longview. This is Tyler, where I'm going to now. And then one done locally in Texarkana. Both of the reports stated that I had a very mild case of thickening, not even to the point to where they would call it cardiomyopathy. And they did not think that I needed any further treatment. And it can worsen over the years, but it doesn't worsen over, for example, a year from not being hardly anything to very severe case, because he told me in the hospital, and he told me again, and he said he has shown several of his colleagues, he's in with other cardiologists, cardiovascular guys, so he's not alone. So I guess he's been passing my file around, I don't know. But because it's such a severe case. Also, but there's nothing he wants to do now. Beyond giving me the new meds, which is the medicines I told you. But he also mentioned, which I did not know, so it must have been new information he got, or it came from the heart cath and he didn't mention, because I don't remember him mentioning, that the open heart surgery I had for myocardial bridge, which is basically where, I don't know artery names, I'm sorry, but it's one that's in the back top, or so it's one of the big ones. All of them are big, but anyway, every time my heart was being squeezed, it was like clamping down completely on a water hose, for example, and then with every heartbeat, so it would be free flow, back up, the blood would back up, free flow, back up constantly. Well, the surgeon in 2013 fixed that, and subsequently he did pass away a couple years after that. He was an older gentleman, sweet as he can be, and I was really sad to hear the news. But he did a good, Sanders was his name, and that was done at Longview, Good Shepherd. He did the doctor told me he did an okay job, but there is still an area, even with the bypass, that area is still, it's squeezing, it's not clamping shut like it was before with every heart rate, but it's still being squeezed. So it's kind of like a water hose. It's being squeezed, but not where the flow stops. So there's still back up. The blood, you understand. So I'm going to have pain from that. And he says when it gets unbearable to where the medication, because I cannot take, oh my God, I've never heard it this way. One of my cardiologists years ago told me, do not take nitroglycerin. With cardiomyopathy, it has something to do with the dilation. They work against each other, and it can exacerbate chest pain, which is exactly what it has always done every time they've given it to me. In the last few years, I will, if they want to try, I'm like, no, because I know what's going to happen. And I get weird looks, and I get doctors that say, what is a myocardial bridge? I'm like, Google it. I had to. I never heard of it. You know, and this is cardio. That's kind of scary when cardiology is saying, what is that you have? But anyway, he flat told me today, he said, because I said, well, why is this medication? Because I was in the ER last night for hours with chest pain. And I said, well, this medication is seeming fine, which is the calcium blocker. But why am I having chest pain when I'm on a new medication for angina or angina? And he said, it's not completely good. It's no matter how many doses you take, it will not completely, because that still has issues. It wasn't completely fixed. I'm still going to have chest pain. And he said, whenever you get to the ER with chest pain, have them call me. And I'm like, for 14 years, I have been going to area hospitals, which is either St. Michael's or Wadley in Texarkana. That's the only 2 hospital options. And after so many years and so many visits and so many times where there'll be a 6-month period where I swear to God I'm going once a week, and it's because my pain medicine, I would have to go to a pain clinic to be able to take stronger than what I'm taking. So the strongest that I have, when it doesn't work at all, and there's nothing I can do because I can't take nitro, and aspirin is not going to do it, although I do take an aspirin because they always end up giving me one in the ER anyway. I go to the ER because I want to make sure it's not a heart attack, because it feels, I'm assuming, like a heart attack would. I've had the whole neck and jaw and thing, pain. So I'm assuming it feels like that or similar. But he told me, in fact, I have a note, and I'm going to cover up my address. But this is my new doctor. I said, would you please write a note? Because if you just say, and he did say, show my card, ask them to call. They're not going to call. They have known me for 14 years, and a lot of them, when they walk in the room, look, I'm not stupid, just like you wouldn't be stupid. We have intuition. It's called reading people's facial gestures. When a doctor walks in the room after seeing me 24 times in the last 4 years, you damn near, you almost see them roll their eyes, because it's like, okay, she's here again. I just know she's a drug seeker. The files that they have say it's not as bad, if they even bother looking at files. And I just hate, just like the doctor last night. I've seen him several times, and he walked in and said it's not a heart attack, walked out, gave me a shot in the butt, and sent me home. Well, I said, can you write something so I can say, look, this is coming from the doctor, and I'll read it to you if you didn't see. Like I said, I'm going to leave my name out. But it says, to whom it may concern. Patient named above is currently under my care. If patient presents to ER with chest pain, please contact me. And then the number, sincerely, and that is his signature. Yes, he's Dr. K, because who can pronounce that name? I don't even know. It's Indian name, and even his name is Alexander, and that is spelled so unique. It's very interesting, but it's just Alex on this. But anyway, I nearly broke down once again when he told me, just like I said earlier, when he first got my file, he was thinking, this can't be possible, this one person have this much stuff. And once because I was there 4 days, they dug a lot. And in between that and my visit today, they dug a lot as well and got more files, because I signed for everywhere I've ever been. And I am shaking this camera, and I apologize. I get frustrated. And this makes me so happy, and it makes me tear up, because I'm like, I finally found a doctor, a cardiologist, because he doesn't do the other stuff, like the blood clotting disorder and all that stuff. But I actually found a doctor who says, Wendy, you are not lying. And he told me that nitro, which I was told years ago, do not take it. He said, because I said, well, why am I having chest pain if I'm on this new medication for angina? Why am I having chest pain? And he said, you're just going to have to. And he said, it's just part of it. And when you can't handle it and you take your medications at home that are supposed to help with that, and it doesn't work, go to the ER for relief. And then, we went through the whole spiel about, I get the way I get looked at a lot of the time. Not all the time. Some of them are super nice. But some of them, you just tell, are so arrogant. And, we just know you're a frequent flyer and I don't know, whatever, drug seeker. But, I totally forgot. Oh, I said, well, what is the other medication can I take? And then, of course, he said nitroglycerin, and he said, and that could kill you. And I'm like, it could actually kill me? Because I said, well, what if I took a little bit? Because they always want to do IV or one pill under the tongue. It's a little tiny pill. Or it's a little patch of goo that they tape to you. Or a little bit in an IV bottle. But I've always had an exacerbation of symptoms or chest pain, where I thought I was this close. If it was an 8 on the pain scale, when I went in after getting nitro, it was a 10, a 12, beyond. I could not bear it, knock me out, kill me, and I have that confirmation. And it's not every day that you get a doctor that does that. And I told him if he ever left me, I'd have to hunt him down. But you know, he said it could kill me, and I said, well, what about a little bit? And it's the only other medication. So now on the market to treat. There's several, I believe, different angina, but I'm on the best one. But anyway, this is super long, and I apologize. And I'm going straight to bed. I might not even upload this tonight, but I know a few of you, my closer friends, have been trying to keep up with my health stuff, and I appreciate it. And I am behind. I'm so behind in videos. I apologize. And also, I know there are so many prayers going up for little Kaysen. Thank you so much for those who have donated, who will donate, and pray. Don't even worry about the money part of it, because God's going to get her. You know what I mean? I appreciate, and I know she appreciates everything people are doing. I wish I could give more. I wish I could, you know, there's so much I wish. I may have a chance next week to see him, because I'll be going to see my sister-in-law. It's going to be an early Christmas present for Sarah, because she adores her. Also, she has a cousin who is autistic as well, more severe than her, but they get each other. You know, it's really interesting seeing them together, because they interact without interacting. It's complicated, but it's beautiful as well. And Cedric my nephew is getting a lot better with touching other people. Not a full-on hug, but he will put his arm around. Last year, 2 years ago, year and a half ago when I was there, whenever it was, not the last visit, because that was Christmas, but the time before, he put his arm around me for the first time. And that is huge. That is huge. You don't understand. If you don't have a special needs child, you don't understand the sensory and the a lot of people have germophobic issues, and Cedric did, especially after his dad died. It was just, he had an overload of emotions he couldn't get out. So he was taking several showers a day, and Lacey was telling him, you can't do that, Cedric, you know. But so we're going to spend a couple days with them, and then be back. We'll be, well, at the end of next week and into the beginning of next week. The end of this coming week and going into the Sunday, okay? Anyway, because we've got more appointments coming up. And this is 17 minutes, and I'm sorry, but I just wanted to update those who are keeping up with me. And like I said, thank you again, everyone who is praying for my son and for my grandson. Not my son, I ain't having no more babies, but my grandson and my daughter. Because I absolutely, 1,000,000% believe in prayer, because I've seen miracles happen in my own body and other people as well. So God bless. You guys take care and do something good for somebody. Okay? Bye. Did I push stop? No, I didn't.